So, good morning, everyone. My name is Nicole Cope, and I am the Executive Director of the Missouri Immunization Coalition. And I will be moderating Dr. Logan's presentation today. So, just a few quick reminders that to please place yourself on mute during the presentation. And at the completion of Dr. Logan's presentation, please raise your hand if you have any questions and use the chat button. So when the session is over, if you press leave the room button, you'll go back to the main lobby where Aaron will be there to meet you. So before we get started, I'm going to just take a few minutes and tell you a little bit about the Missouri Immunization Coalition. So we are a statewide nonprofit, and we were incorporated in January of 2020. And our mission is to promote immunizations, prevent disease, and protect all Missourians. Our coalition has more than 330 members that consist of physicians, physician assistants, nurses, nurse practitioners, pharmacists, public health professionals, public health departments, hospitals, businesses, policymakers, and community organizers. We are dedicated to keeping Missouri healthy by building awareness for vaccines, educating healthcare providers and the public, and advocating for policies that protect all Missourians with the goal of increasing vaccination rates throughout the state. We have four main tenets that help us to accomplish our mission. The first is coalition building. The MIC's coalition building strategies leverage the collective voice of Missouri's diverse population on immunization priorities, policies, awareness, and resources in support of promoting vaccinations and health of our communities. The next tenet is community outreach and awareness. Our coalition's community outreach efforts build awareness for parents about the safety and importance of immunizations. We also provide immunization education and information for the state's healthcare providers. The third primary tenet is public policy. The Missouri Immunization Coalition brings together a diverse group of healthcare professionals, public health professionals, business leaders, parents, and community members to help inform public policy. And our final tenet is provider education. This enables Missouri's healthcare professionals to make strong provider vaccine recommendations, adhere to proper vaccine safety protocols, provide information to parents on the importance of vaccination, address vaccine hesitancy, and remain up to date on the latest immunization recommendations. So last week, the Missouri Immunization Coalition was awarded a contract from the Department of Health and Senior Services for COVID-19 prevention and immunization education. The goal of this contract is to develop programs, trainings, and immunization events focusing on COVID-19 immunization administration, education, and training for underserved populations and professional staff employed by small rural hospitals, critical access hospitals, and FQHCs. Just a few of the ways we intend to do this are to engage local public health agencies and determine participation interest in pop-up collaborative events, hosting COVID-19 vaccination clinics, and providing COVID-19 immunization continuing medical education units for our state's healthcare providers. One of the ways we'll be doing that is we will be hosting statewide ECHO presentations. So with that said, the Missouri Immunization Coalition is hiring. So if you know of anyone that might be a good fit for the Missouri Immunization Coalition, we are looking for a project manager, 2 health educators, a communications manager, and a development manager, and an administrative assistant. So again, if you know of anyone that would be a good fit to work for us, or if you would like to join the Missouri Immunization Coalition, please let me know. I will put my contact information in the chat. But without further ado, I'd like to introduce to you Mr. Dr. Richard Logan. Dr. Logan is a lifelong resident of Charleston, Missouri. He is a graduate of Charleston R1 High School, where he obtained a BS in pharmacy degree from the University of Missouri, Kansas City, and a doctorate of pharmacy from Creighton University. Dr. Logan and his son, Dr. Tripp Logan, also a pharmacist, own and operate 3 independent pharmacies in Southeast Missouri. Dr. Logan's pharmacies are focused on patient care and patient outreach and depend heavily on the 7 community health workers on their staff. Dr. Logan has participated in multiple COVID-19 vaccination clinics, from mass vaccination clinics to small pop-up clinics in rural Missouri. So welcome, Dr. Logan.
I guess now's the point I turn my camera on and scare everybody. Good morning. Good morning. Thank you for having me. If we could, yeah, there we go. I'd like to thank the Missouri Rural Health Coalition and Nicole from the Missouri Immunization Coalition for actually having me here. And as painful as this presentation may be for those of you listening to me, I do appreciate the opportunity. We're going to give a little perspective on what went on in Missouri. Next slide, please. Specifically in my little area of Missouri, the southeastern section. Next slide. And even more specifically from where I sit right now, actually in my home office, in Charleston, Missouri, in Mississippi County. Like most of rural Missouri, this area of the state is we're highly agricultural. Our demographics are we're some of the poorest area in the state, have the poorest folks, the poorest health literacy. We say we are the land of fried chicken, fried catfish, sweet tea. That pretty much describes our whole area of the state. And if you have ever driven from St. Louis south on I-55 towards Memphis, you will have noticed that at mile marker 82 on I-55, the world changes. You go from a Ozark rolling foothill to mile marker 82, which opens in front of you the flat beginnings of the Mississippi Delta. And of all you read about the Mississippi Delta and the issues they have, these are the same issues that we have in southeastern Missouri. Next slide, please. I'd like to take you on a bit of a historical trip, maybe painful for some of us, back to COVID in the early part of 2020, probably the latter part of 2019, just to level set as to where we were in our county at this time. We watched in early 2020 as COVID began to steamroll onto both coasts. We watched, next slide, please. We watched as ICU beds began to fill up. From the safety of rural Missouri, we watched, next slide, please, mobile hospitals began to pop up. We watched ICUs fill up. We watched people getting sicker and sicker and sicker from COVID. We watched hospitals on both coasts call in refrigerated trucks for morgues. This was a dark time. It was a dark time. We watched our colleagues working tirelessly for patients. We watched while they went to extremes to treat patients, and Those of us who were not in the breach learned from their experiences. But next slide, please. But what we learned was frightening. We were afraid. We were afraid of what is going to happen when this gets to us. Next slide, please. We sit in Mississippi County uh, in the far southeastern corner of Missouri. We are 20 miles from the closest hospital. The two cities you see circled here, Charleston and East Prairie, are the only two that have any medical facility whatsoever. We have uh, clinics and pharmacies, and our local health department are housed in these two towns. Uh, we we watched as the juggernaut of COVID moved closer and closer to us. We, from the safety of our rural area, we watched the hospitals in St. Louis and Kansas City and Springfield begin to become overwhelmed. And then we began to see the trickle of patients at our local hospital in Scott County in Sikeston begin to fill up. Um, and we realized that COVID was here. It was among us, and we had to do something. Local pharmacy level, we closed our lobbies. We went to curb service. The physicians' offices quit seeing patients in office. Most went to telehealth of one sort or another, realizing that there were people who were going to fall through the cracks. Our pharmacies stepped up our outreach communications to people. Um, do you have your medicine? Have you been able to get to your physician's office? Or have you been able to talk to your physician? Do you have medicine? All of these things that our community health workers were assigned to do. During this time, um, with our lobbies closed at the pharmacy, and I reiterate, this was a dark time. Um, it was scary. The unknown was frightening. It seemed really dark, um, but still, our healthcare professionals had to persevere. In our pharmacy, I uh, started doing, because of local need, uh, rapid COVID testing. So I would bring possible COVID patients into the pharmacy to test to see if they actually had the virus. Um, it led at one point, my wife and I were driving, and she said to me, uh, "What what if you get this virus? What if you bring it home to me?" And understanding that at this time we had lost uh, two childhood friends from COVID. And I had to look at her and say, I signed up for this. This is what I do. It's what I'm going to do. You did not sign up for this. I will, we happen to have a little rental house. I said, I'll move into the rental house. Uh, and she said, no, we're in this together, and we're going to beat this thing together. So we began changing the look of our pharmacy. Next slide, please. I built sneeze guards. And then, next slide, please. I built more sneeze guards. And then I built more sneeze guards, um, knowing that at some point in time, we are going to have to get patients back into the pharmacy, back into the physician's offices. Um, the hospitals will have to. The hospitals were trying to do so many things at that time. They were so overwhelmed. Um, we knew that at some point we were going to have to take care of people with diseases other than COVID. So, next slide, please. We heard there's a vaccine that's received emergency use authorization. Uh, we immediately had visions of the federal government coming in, and I'm a child of the polio generation, of coming in and setting up at the local armory and running a whole town's population through to receive vaccine, um, like was done during polio. But then we thought, well, we don't have an armory anymore, and things are different than they were in the late 50s and early 60s. And we found out that the government was going to distribute vaccine, not shots. Um, that there would be some mass vaccination clinics, but the clinics may not reach all of the population that needed to be reached, which, as it turns out, are my patients. They are the members of my community, the people I care for, the people I care about. Um, Pharmacy at that time was pretty limited. We could only do vaccines in pharmacy walls where we had a collaborative practice agreement. Our technicians could not operate out of pharmacy walls. Um, we we didn't know what we were going to do at that time. And then the state stepped in and said, "What kind of barriers do you have to delivering vaccine?" We said, "Well, first, we don't have vaccine. And second, we've got all these regulatory barriers." And the state came to us and said, "We're removing the barriers. Let's get together. Let's do this as best we can. And let's get shots in arms." Next slide, please. So what we had was um, no plan. Uh, None of us had ever been through this before. Uh, I guess the last time anything similar to this was maybe the pandemic of 1918. Uh, we knew as a pharmacy that we did not have the personnel to do it. We knew the health department, which was absolutely slammed at that time, did not have the bandwidth to provide vaccinations to a county. Uh, None of us in the early stages were receiving enough vaccine to really, I won't say not to make a dent, but to make a sizable dent in the population of the county, which our population is about 14,000. Uh, what we did have was 4 pharmacies in the county, with each having vaccinators available, but not a single one of us had the bandwidth to vaccinate a whole county. Next slide, please. But what we did have, we had a very good working relationship. Um, all of our pharmacies, all 4 of them, there are 2 pharmacies in East Prairie, 2 pharmacies in Charleston, both, all 4, both cities, independent practices, no chain pharmacies. We all get along, we're all friends, and we all faced a common goal: taking care of our patients. We As L&S Pharmacy, my pharmacy, we have an excellent working relationship with our county health department, which is housed in Charleston. Um, we have worked many projects with them, so we reached out. We started. uh, communicating back and forth between all of the pharmacies and the health department and our county government. Next slide, please. So what we had was the birth of a cooperative effort. Um, we we knew that if we pooled resources, if we did what we needed to do, that we could make a sizable dent in vaccinating the population of Charleston. Uh, the pharmacies you see here, uh, LNS Pharmacy, Simmons and Graham Pharmacy, both in Charleston, Buton Drug and Main Street Pharmacy in Charleston, and our Mississippi County Health Department. We had multiple meetings, multiple strategizing session to make a plan. Next slide, please. What we decided to do was pool our resources. That we would use vaccinators from each entity. I think probably total in the beginning, we had 10 or 12 vaccinators. We would use vaccine supply from each entity. As we were making these decisions, the presiding commissioner of our county commission came to me, he's a lifelong friend, high school classmate, uh, came to me and said, "What do we need? Uh, what what's going on? How can we help?" He said to me, we're the county commission. We cannot give shots. We cannot do anything clinical, but we can support you on the backside. So they offered infrastructure, helping set up clinics, parking, recruiting clinic volunteers. I sat down, this friend of mine, we designed a workflow that we thought, pardon me, that we thought would work in a large scale vaccination clinic. We all got together, excuse me, and subscribed to an online scheduler. We set up each entity, all four pharmacies, and the health department had access to a scheduler. Uh, if a person wanted a vaccination at one of our planned clinics, they would call one of the entities. Now, you have to understand, these aren't entities that are unfamiliar to them. This is not somebody from St. Louis calling somebody in Neosho. These are people that we deal with every day that have our phone numbers, and hopefully uh, we have their trust. We set up this online scheduler. The folks would call in to whichever entity they felt most comfortable with, and that entity would set up an appointment. We decided it was best to set up an appointment rather than just open the clinics up, because we had limited supply a vaccine. We didn't want to waste vaccine, and we didn't want scenes where people were rushing a clinic uh, and not being able to be vaccinated. We just didn't want to be overwhelmed. And then we also worked together to recruit a bank of volunteers that called each person that registered before the clinics to remind them of the clinic. And not only that, to track that person and call them to remind them of their second shot at the next clinic. Next slide, please. So it sounds good in theory. It kind of looked good on paper. We thought, well, maybe we're onto something. But I will tell you, when we opened the doors of the first clinic, we were quite nervous. We didn't know if uh, we would be swarmed. We didn't know if we would have anybody show up. We just didn't know. So this is what clinics looked like. We picked facilities. As you see here, this is the Charleston United Methodist Church. Uh, Next slide, please. Uh, we picked facilities we thought that would work. Uh, this church happened to have a porte cochere, the awning that people could drive through if they couldn't get out of their vehicles. Uh, they would drive up, receive their shot, sit in the parking lot 15 minutes to wait. Next slide, please. We took over the family life center of really every church or every gymnasium that we used, and we used two different churches and uh, one civic center with a gymnasium for all of our clinics. Our workflow: people would walk in the front door and stand at the brown table you see in front of you that was manned by volunteers. The volunteers would check the person's name off of a list. After that was done, they would proceed back to the round tables you see behind, and we had volunteers at each table to assist with paperwork so that we could get our consent to vaccinate forms filled out. From there, they proceeded to the very back table where the forms were double checked, and then they were by volunteers, and then they were handed off to other volunteers to go to the waiting area to wait for a vaccinator. And I will say that in any of our clinics, if any single person had to wait 10 minutes for a vaccination, that would have been considered a long wait to us. Next slide, please. When they went from the waiting area to the vaccination area, you will notice we have tables, chairs, and some privacy screens set up. Each vaccination station had a chair for the patient, the vaccinator, and a volunteer scribe. The scribe filled out the permanent vaccination cards so the person doing the actual vaccination did not have to take the time to do that. Uh, the vaccinator was purely in charge of the vaccination and clinical decisions as to if to vaccinate, if there was a reason not to, reviewing the immediate medical history, that sort of thing. Uh, Next slide, please. After the vaccine was administered, uh, the person then proceeded to the waiting area. Our waiting area is designed to hold people after vaccination so we can observe them for any adverse reaction that may happen to them after they got vaccinated. This was staffed by volunteers. We had volunteers, one of which was a retired nurse practitioner who, at every single clinic we had, volunteered her time to keep an eye on the folks that had been vaccinated so that once again, the people who were actively vaccinating did not have to divide their time with um, uh, clinical observation and actually doing the vaccines. We wanted to make sure that if somebody came in to be vaccinated, that there was a vaccinator that was able to put that shot in that arm within a very few minutes and not having to observe the folks that were waiting. So, next slide, please. So, how did it work? Um, these are two screenshots from on the left is KFVS TV from June of this year. You'll remember that we're in Mississippi County doing this. We were third most vaccinated county behind Cape County and Scott County. Cape County had two very large health systems that were dedicated uh, to vaccinating. Scott County's health system not only helped us, but spent a lot of time outreach with their own clinics. Mississippi County was the only one without a health system in this top three, uh, and of that I'm pretty proud. Although I would like to have seen that number be 70% rather than 30%, just to know that the effort we expended was at least worthwhile. On the right is a screenshot from the New York Times. Actually, it says August 2020 was last week. And if you will notice, just as a nuance on this 65 plus, at the time we were doing our mass vaccination clinics, we were limited to people 65 years of age and older. Um, so we have 64% of that population vaccinated in our county. Um, I think that's a testament to our efforts and our volunteers and our follow through. Um, I, I don't think you can safely claim success in any of these clinics if you give a first shot and it's not followed in due course by the second shot. And we found that required follow up with individual patients. Next slide, please. Um, the plan worked really well, we thought. Some of our clinics would do 200 vaccinations, some of them would do close to 700 vaccinations, all in a very orderly and timely fashion. And that plan worked. It worked well. It worked well until it didn't. And towards the end, attendees to vaccination clinics tended to peter off. We noticed a drastic decrease. And what we knew going into this was that there would be three groups that we would see. Uh, the ones that are anxious to get vaccinated, I want it now. I want the second one as soon as I can get it. I'm ready to get this behind me. Let's get it done. These were the main attendees of our clinics. It it was really funny in some of these mass clinics. Um, it was like a large social occasion because everyone was so happy to be there, so happy to get that shot. We actually had some of our folks that after their 15 to 30-minute wait, we had to run them off because they were so glad to be out after being uh, sequestered at home for so long. Uh, they just wanted to stay and visit. We had some that camped out and brought their lunch, but after lunch we said it's time to go home. Um, that was the population, the number one population at our mass clinics. The number two population, they were cautious. They wanted to wait and see. They wanted to let these other people be guinea pigs. Um, a lot of them we didn't reach in these mass vaccination clinics. And then there was the third group, the there is no chance in the world that you're going to get me. I am not taking that vaccine. That vaccine was rushed through all of the things you've ever heard about. No chance. And we took that to be, at least not now, we'll get you soon. we have never given up hope on reaching out to those vaccine hesitant folks. Next slide, please. So, what about these groups 2 and 3? We knew that we would have to maintain vaccine availability. All of the entities involved realized that our mass clinics had served their purpose, that we had done about all we could there, but we knew that we had to make sure that vaccine was still available as groups 2 and 3 began to change their mind and come online. So what we did was we all got together and we have staggered our clinics that we have brought in-house. Um, we each individually continue to do outreach and education and expand our efforts uh, for vaccination, the vaccination hesitant, but bringing the vaccination itself in-house as much as possible and staggering the days so that any day anybody wants a vaccine in Mississippi County, you're pretty well assured that you can get a vaccination. Uh, whether my pharmacy does Wednesday, Thursday, the health department does Monday, Friday, another pharmacy does Tuesday, Thursday, however it works. We wanted to make sure to maintain vaccine availability. Next slide, please. We also knew that with no more mass clinics, our our outreach was going to have to redouble. Uh, we being uh, my team, and my team consists of pharmacists and community health workers and some pharmacy technicians. Um, we have participated in civic events, church events, pop up clinics. We do house calls every week for people who are homebound. Uh, Day before yesterday, I gave, let's see, 4 or 5 shots day before yesterday to homebound. Um, I- we, with the approval of Pfizer vaccine to those 12 and up, we expanded our efforts. We are in the process of uh, increasing our education efforts to both children and parents. Um, it's necessary in that environment that the children want it and the parents accept it. That's not always easily done. So that's almost a dual message. We have started outreach to schools. The local health department has started reaching out to schools, sporting events. I've been to baseball practice and done vaccinations on the parking lot of uh, baseball practice. Anything where kids congregate. I even went to a dance recital and vaccinated at a dance recital. Um, Things have changed. It's not mass vaccination clinics anymore. There's there's a pause and a question mark after that, after yesterday. But we'll get into that in a minute. Um, Next slide, please. What what the new look of vaccination outreach is? Uh, this is, I mean, this is what we're doing these days. Myself and two of my community health workers last Sunday went to a small church, which granted me the opportunity to stand in front of their congregation. And I will have to say, I tend to preach a sermon like a Baptist preacher to tent revival. I tried to call down the lightning on them, and it was just a marvelous experience. I had such a good time at this church, and we gave 11 vaccinations, mainly to kids. I think this is the new look of vaccination outreach. It's a personal outreach. It's giving them education that will discredit a lot of the trash they're reading on Facebook and Instagram and on the internet. I've had to reassure people that no, it does not magnetize you. You are not destined to stick to your refrigerator for eternity. Uh, what it does is it keeps you from getting sick enough to die. That's our point. Next slide, please. Now, the next slide is a where we are slide. Um, and I will say that when I finished this slide deck, which was this week, there had not been as much talk about booster shots. And I'll get into that in a minute. Um, what we have seen since the 1st of August is a really large uptick in vaccination requests, which is a wonderful thing. I would love to take credit for that. I would like to say that, wow, look at these efforts we're expending. This is what's going on. But no, I think this is just what's happening in the world, whether it's the Delta or the kids going back to school factor, and they don't want to live through another year like they had last year. Who can blame them? Um, our our in-house clinics, we have seen close to a doubling of people who will come to the pharmacy to get vaccinated in the last few weeks. Uh, we've had more church requests for information and vaccination clinics. I'm scheduled a lot of Sundays between now and the end of September. Um, the 12 to 18 population is really stepping up. Every time I give a shot to a kid in that age group, well, most everybody really, but especially in that age group, I thank them for being brave. Uh, they're hearing a lot of different things about this vaccine, but they know they want their life to return to normal, and that's the way to do it. I thank them for being brave, and I tell them, excuse me, I tell them to tell their friends that we need more kids stepping up. We've seen moms sending dads. Mom will say, "I've got my vaccine. You go get yours. Uh, I'm not going to take care of you if you're sick." And we have seen a real uptick in uh, people whose employers are supporting their decision to get vaccinated. They'll give them paid hours from work and a bonus to get vaccinated. I think the the workforce is going to make a big difference. Um, when, as I said, when I prepared these slides, I had uh, we had not received any authorization for booster shots. And in the last 48 hours, we have. So this is going to change the dynamic more. We've already been fielding, I know yesterday I fielded at least 5 calls for people wondering when we're going to be able to give booster shots. Um, that reflects, I think, back on that initial group, the number one group that was really anxious to be vaccinated. But that's going to really increase our vaccination rates in the next, I would say, 90 days, or at least between now and the end of the year. I'm really kind of excited to see how that goes. Uh, I don't know if we're going to have to set up mass vaccination sites again. I tend to doubt it, because we're really more set up than we were before to deliver more vaccinations. So with that, I think that pretty well brings us up to date on what's happening in my little corner of Southeast Missouri. I will say that the last efforts have extended past Mississippi County to, well, all the way from Mississippi County to the border of Arkansas, and we're in the process of extending those efforts west towards south central Missouri. So, at the close,